Ilya Sutskever warns of AI's unpredictability. Could revolutionary medical advances be just the beginning? Date of event, June 29, 2025. Summary: Ilya Sutskever, the co-founder and chief scientist of OpenAI, has recently raised significant alarms regarding the unpredictable nature of artificial intelligence (AI). As AI technologies advance, especially in revolutionary fields like medicine, Sutskever warns that these advancements could lead to unforeseen challenges and ethical dilemmas that society may not be ready to handle. The unpredictability of AI. Sutskever's primary concern lies in the unpredictability of AI systems. Despite being designed and developed by humans, these complex systems can behave in ways that are difficult to foresee. This unpredictability is attributed to the intricate nature of AI algorithms and the vast datasets they analyze. As Sutskever aptly puts it, the potential outcomes of AI development can be extremely unpredictable and unimaginable. This assertion calls for a more cautious approach to AI research and implementation. The unpredictability of AI poses a significant risk, particularly in high-stakes fields like healthcare. AI's ability to process and interpret enormous amounts of data can lead to breakthroughs in drug discovery and personalized medicine. However, these advancements come with a caveat. The potential for unintended consequences looms large, especially if AI technologies are deployed without stringent oversight and regulation. Revolutionary medical advances. AI has already begun to revolutionize the medical field, offering promising solutions that could transform patient care. From accelerating drug discovery to enabling personalized treatment plans, the potential benefits are substantial. For instance, AI can analyze genetic information and patient data to tailor therapies to individual needs, potentially improving outcomes significantly. However, while these innovations could lead to remarkable improvements in healthcare, Sutskever emphasizes that they also introduce significant risks. The dual-edged nature of AI signifies that for every positive outcome there could be detrimental effects if these technologies are not managed responsibly. The ethical implications of AI in medicine are vast and complex, necessitating a thorough examination of how these tools are developed and used. Potential dangers of AI. One of Sutskever's critical points revolves around the dual nature of AI as both a powerful tool for progress and a potential source of harm. The remarkable capabilities of AI can lead to unintended consequences which may arise from biases in training data, misinterpretation of results, or lack of transparency in decision-making processes. If left unchecked, the deployment of AI in sensitive areas such as healthcare could inadvertently cause harm to patients. Sutskever's warnings highlight the need for robust frameworks to guide AI development, ensuring alignment with human values and safety. Without such frameworks, the risks associated with AI could overshadow the benefits, leading to societal challenges that are difficult to navigate. Integration of information and community insights. As discussions surrounding AI's unpredictability unfolded, it is essential to integrate insights from various sources. Although access to some Reddit discussions was blocked, the overarching message remains consistent. The unpredictability of AI systems demands careful consideration of ethical implications and potential risks. Community discussions on platforms like Reddit reflect a diverse range of opinions and concerns, contributing to a richer dialogue on the future of AI. The engagement of the AI research community, policymakers, and the public is crucial as society grapples with the complexities of AI's evolution. Sutskever's cautions serve as a rallying call for collaboration and open conversation about the direction of AI research and its implications. Common key points and differences in sources. Across various platforms, a central theme emerges from Sutskever's statements: the necessity for caution in AI development. While some sources provide detailed accounts of his views, others may reflect broader community sentiments that add depth to the conversation. The convergence of these perspectives underscores the urgency of addressing ethical challenges in AI. The contrast between detailed insights and community discussions illustrates the multifaceted nature of the conversation surrounding AI's unpredictability. Engaging with varied viewpoints can enhance understanding and foster a more comprehensive approach to AI governance. Timeline of events and ongoing dialogue. Sutskever's warnings are part of an ongoing dialogue within the AI research community responding to earlier discussions on AI governance and ethics. As AI technologies continue to evolve rapidly, the importance of responsible management becomes increasingly evident. The timeline of events reflects a growing awareness of the ethical implications associated with AI advancements. In conclusion, Ilya Sutskever's cautions mark a pivotal moment in AI development. The promise of revolutionary breakthroughs in fields like medicine is accompanied by the pressing need for responsible management and foresight. As society navigates the complex landscape of AI's future, open dialogue and collaboration are essential to mitigate potential risks and ensure that AI technologies align with human values. This report encapsulates the key insights from Ilya Sutskever's warnings about AI's unpredictability and the implications for revolutionary medical advancements, emphasizing the need for ethical considerations and robust frameworks as AI technologies continue to evolve. Ilya Sutskever's warnings about the unpredictability of AI present several counterintuitive insights that challenge conventional wisdom about the advancement of technology, particularly in the medical field. Here are some of the notable counterintuitive points derived from his discussions and the overall implications of AI's evolution. 1. Advancements and risks coexist. The prevailing belief is that technological advancements, especially in medicine, are inherently positive and lead to improved outcomes for humanity. However, Sutskever argues that the very innovations that promise to enhance healthcare, like personalized medicine and automated drug discovery, may also introduce significant risks. This perspective suggests that as we gain more powerful tools, we may simultaneously create new vulnerabilities, which contrasts with the optimistic view that technology solely serves to improve human life. 2. Unpredictability as a norm. Many people assume that with more data and sophisticated algorithms, AI systems will become more predictable and controllable. Yet, Sutskever emphasizes that the complexity of AI systems can lead to unpredictable behavior that even their creators cannot foresee. This notion challenges the assumption that increased intelligence and capability directly correlate with improved predictability and safety. 3. Ethical frameworks may lag behind technology. There is a common belief that ethical frameworks and regulations can keep pace with technological advancements. However, Sutskever's insights suggest that the rapid development of AI may outstrip our ability to create comprehensive governance structures. This creates a paradox where the very technologies meant to enhance societal welfare could also lead to ethical dilemmas that society is unprepared to handle. For trusting AI can be dangerous. The assumption that AI systems are reliable and can be trusted to make decisions leads to the risk of complacency. Sutskever warns that this trust can be misplaced, as AI systems might produce outcomes that are not just unpredictable but also harmful. This counters the narrative that as AI becomes more integrated into critical sectors like healthcare, we can rely on its outputs without substantial oversight. 5. Potential for a dual-use dilemma. While many view AI as a tool for solving global challenges, Sutskever's warnings highlight that the same technologies can be used for harmful purposes or lead to negative societal impacts. This dual-use nature of AI is often overlooked, suggesting that innovations celebrated for their potential benefits might also facilitate significant risks, thereby complicating the narrative of technological progress as purely beneficial. 6. Overemphasis on capability over safety. The tech industry often emphasizes the capabilities of AI, what it can do, rather than the implications of its deployment. Sutskever's concerns bring to light that this focus on capability can lead to neglecting the necessary discussions about safety oversight and ethical considerations. This raises the counterintuitive notion that our desire for progress could lead us to ignore the foundational principles of safety and ethics. 7. Human values may be compromised. there is an assumption that as AI becomes more advanced, it will inherently align with human values and priorities. Sutskever cautions against this belief, asserting that without deliberate frameworks and regulations, AI may operate in ways that are misaligned with human ethics and priorities. This challenges the optimistic view that technology will naturally evolve to serve humanity's best interests. 8. Disruption beyond traditional boundaries. Many discussions around AI focus on its impact within specific fields such as healthcare or finance. Sutskever's warnings suggest that the disruptions caused by AI could extend far beyond these sectors, affecting societal structures, interpersonal relationships, and even cultural norms in ways that are not yet fully understood. This long-term broad-spectrum impact contrasts with the more myopic view of technological change being confined to specific industries. 9. Community discussion and misinformation. While Reddit discussions and community forums often revolve around optimistic perspectives on AI, Sutskever's caution highlights the gap in public understanding regarding AI's risks. The assumption that community discussions reflect a well-informed consensus may be misleading, as they can also propagate misinformation or oversimplified views that fail to account for the complexities of AI technology. In summary, Ilya Sutskever's insights into the unpredictability of AI reveal several counterintuitive truths that challenge optimistic views on technology's role in society. His warnings urge a re-evaluation of how we approach AI development, emphasizing the need for caution, ethical considerations, and robust governance frameworks to navigate the complexities of a rapidly evolving technological landscape. Ilya Sutskever's recent warnings about the unpredictability of artificial intelligence (AI) encapsulate a crucial discourse in the intersection of technology and ethics, particularly concerning revolutionary advancements in fields such as medicine. While many may focus on the immediate benefits of AI, Sutskever's insights urge a deeper examination of the often overlooked complexities and potential risks associated with AI systems. Key overlooked insights. 1. Complexity and unpredictability. The complexity of AI systems can lead to behaviors that are unforeseen even by their developers. This unpredictability is not merely a technical issue but a fundamental characteristic of advanced AI, which can learn and adapt in ways that diverge from initial programming. Many discussions around AI focus on its capabilities such as efficiency and accuracy, often neglecting the implications of its unpredictable nature. Understanding this unpredictability is significant because it challenges the assumption that we can fully control or foresee the outcomes of AI applications, especially in life-critical areas like healthcare. 2. Ethical implications of medical advances. The advancements in AI-driven medical technologies such as personalized medicine and drug discovery present a double-edged sword. While these innovations hold the promise of improving patient outcomes and streamlining healthcare processes, they also introduce ethical dilemmas that are frequently underestimated. For instance, the potential for bias in AI algorithms can lead to unequal healthcare outcomes, exacerbating existing disparities. Recognizing these ethical implications is vital for developing frameworks that ensure equitable access to AI benefits and prevent harm. 3. Unintended consequences. Sutskever emphasizes that AI can lead to unintended consequences, a point often glossed over in optimistic narratives about technological progress. This notion is significant as it highlights the necessity for rigorous testing, oversight, and regulatory measures before deploying AI in sensitive applications. The failure to account for potential negative outcomes could result in significant harm, particularly in areas where decisions impact human lives. 4. Need for robust governance. Sutskever's call for robust frameworks to align AI development with human values and safety is often overshadowed by discussions focused on technological advancement. The urgency of establishing comprehensive governance structures is critical as AI systems become more integrated into society. These frameworks must not only address the technical aspects of AI but also consider societal values, ethical norms, and public welfare. The lack of attention to governance could lead to a regulatory vacuum, where AI technologies evolve without adequate safeguards. 5. Community dialogue and diverse perspectives. The inaccessible Reddit discussions surrounding Sutskever's statements likely reflect a range of opinions and concerns within the AI community. Engaging with these diverse perspectives is essential for a holistic understanding of the implications of AI. The community's insights can reveal grassroots concerns that may not be captured in more formal analyses, thereby enriching the discourse on AI ethics and governance. 6. Historical context and future implications. Sutskever's warnings should be contextualized within a broader historical narrative of technological advancements where initial optimism often gives way to unforeseen challenges. The historical tendency to underestimate the risks associated with emerging technologies underscores the importance of learning from past experiences to inform current and future AI development. This historical perspective is significant as it encourages a cautious approach to innovation. Promoting foresight over blind optimism. 7. Alignment with human values. The alignment of AI systems with human values is a recurring theme in Sutskever's discourse, which often gets lost in technical discussions. This alignment is critical to ensure that AI technologies serve the public good rather than exacerbate existing problems. The challenge of aligning AI with diverse human values necessitates ongoing dialogue among technologists, ethicists, and the public, highlighting the importance of collaborative governance in shaping the future of AI. Conclusion. Sutskever's warnings about AI's unpredictability and its implications for revolutionary medical advances signify an urgent call for responsible innovation. The potential benefits of AI must be balanced against the ethical and social risks that accompany its deployment. By focusing on the often overlooked aspects of unpredictability, ethical implications, governance needs, and community engagement, stakeholders can better navigate the complex landscape of AI development. This approach is essential not only for safeguarding public welfare but also for ensuring that the advancements in AI contribute positively to society as a whole. Understanding these nuances is critical as we move forward in an era where AI's influence continues to grow and the stakes become increasingly high. 1. Unpredictability of AI. Ilya Sutskever's assertion that AI systems exhibit unpredictable behavior is a fundamental concern that warrants in-depth analysis. This unpredictability arises from the complexity of these systems and the vast datasets they utilize. The implications of this unpredictability are profound as it challenges the traditional understanding of accountability in AI development. The potential for AI to generate unimaginable outcomes necessitates a re-evaluation of how we design, implement, and regulate AI technologies. A thorough exploration of the mechanisms behind AI unpredictability, including the limitations of current models and the role of emergent behaviors, is essential for understanding the risks associated with AI deployment. 2. Ethical considerations in medical advances. The integration of AI into healthcare presents both remarkable opportunities and significant ethical dilemmas. While AI-driven advancements such as personalized medicine and accelerated drug discovery promise transformative benefits, Sutskever's warnings highlight the need for a cautious approach. An in-depth discussion of the ethical implications of these technologies is critical. This includes examining issues of bias in AI algorithms, the potential for unequal access to advanced medical treatments, and the importance of informed consent in the use of AI in healthcare settings. Additionally, it is vital to consider how to balance innovation with patient safety and ethical standards in medical practice. 3. Dual-edged nature of AI innovations. Sutskever's characterization of AI as a dual-edged sword emphasizes the potential for both positive and negative consequences stemming from its advancements. Understanding this duality requires a nuanced analysis of specific case studies where AI technologies have led to unintended outcomes. For instance, while AI may improve efficiency in medical diagnosis, it could also perpetuate existing biases or lead to misdiagnosis. Examining historical examples of technological advancements that were initially heralded as breakthroughs but later revealed significant risks can provide valuable lessons for the current AI landscape. This analysis should also explore the mechanisms for mitigating risks associated with AI deployment, such as regulatory frameworks and ethical guidelines. 4. Need for robust governance frameworks. Sutskever's call for robust frameworks to guide the development and deployment of AI technologies underscores a critical area for discussion. As AI becomes increasingly integrated into various sectors including healthcare, education, and finance, establishing governance structures that prioritize human values and safety is paramount. An examination of existing governance models such as those proposed by international organizations and ethical bodies can inform the development of effective regulatory approaches. This discussion should also consider the role of interdisciplinary collaboration among technologists, ethicists, policymakers, and the public in shaping the future of AI governance. Additionally, it is essential to explore how to engage diverse stakeholders in the conversation about AI's impact on society and ensure that governance frameworks remain adaptable to the rapidly evolving nature of AI technologies. In conclusion, Sutskever's insights provide a critical lens through which to examine the complexities of AI development and its implications for society, particularly in the medical field. Addressing these 4 key points through in-depth analysis and discussion can help illuminate the path forward in navigating the challenges and opportunities presented by AI technologies. Here are 3 famous historical cases that illustrate the unpredictability and potential consequences of groundbreaking innovations similar to the concerns raised by Ilya Sutskever regarding artificial intelligence. 1. The development of the atomic bomb. Manhattan Project. The Manhattan Project, initiated during World War II, led to the creation of the first nuclear weapons. Scientists and military leaders involved, including figures like J. Robert Oppenheimer and Enrico Fermi, were driven by the urgency to develop a weapon that could end the war. While the atomic bomb represented a monumental scientific achievement, its deployment on Hiroshima and Nagasaki resulted in unprecedented devastation and loss of life. The unpredictability of nuclear technology extended beyond warfare. It raised ethical questions regarding the potential for global annihilation, environmental consequences, and the moral responsibilities of scientists. The aftermath of the bombings initiated a complex dialogue about nuclear ethics, deterrence, and disarmament, highlighting the dual-edged nature of revolutionary scientific advancements. 2. Thalidomide tragedy. Thalidomide was initially introduced in the late 1950s as a safe sedative and was later marketed to pregnant women to alleviate morning sickness. However, it became clear that the drug had severe and unforeseen side effects, leading to thousands of children being born with severe deformities and disabilities. The thalidomide tragedy underscored the unpredictability of pharmaceutical advancements and the dire consequences of inadequate testing and regulation. This event prompted significant reforms in drug approval processes worldwide, including the establishment of stricter regulations and oversight to ensure drug safety, thereby reshaping the landscape of pharmaceutical ethics and responsibility. 3. The introduction of DDT, dichlorodiphenyl trichloroethane. DDT was first synthesized in the late 19th century and gained popularity as an insecticide during World War II to control mosquito populations and prevent the spread of malaria and other diseases. Initially hailed as a miracle chemical, its widespread use led to significant agricultural productivity and public health benefits. However, over time the long-term effects of DDT became apparent, including its persistence in the environment and bioaccumulation in the food chain, leading to harmful effects on wildlife, particularly birds. The publication of Rachel Carson's Silent Spring in 1962 raised awareness of the environmental and health risks associated with DDT, contributing to its eventual ban in many countries. This case illustrates how a seemingly beneficial innovation can yield unpredictable and devastating ecological consequences, necessitating a re-evaluation of human interaction with chemical technologies. These cases reflect the broader theme of unpredictable outcomes associated with revolutionary advancements, highlighting the need for careful consideration of ethical implications and potential risks in the face of rapid technological progress. Ilya Sutskever's recent warnings about the unpredictability of artificial intelligence (AI) underscore a critical conversation about the future of technology, particularly in transformative sectors like healthcare. While AI promises revolutionary advancements, Sutskever's insights compel us to consider the potential consequences of unregulated and unforeseen developments. Here are predictions and insights regarding the future of AI, particularly in the medical field and beyond. Predictions for the future of AI in medicine. 1. Continued medical breakthroughs. AI is poised to revolutionize medicine further. We can expect significant advancements in drug discovery, diagnostics, and personalized medicine. Machine learning algorithms will likely analyze vast datasets to identify potential treatments faster than traditional methods, leading to breakthroughs in complex diseases such as cancer and neurodegenerative disorders. 2. Integration with genomics. The integration of AI with genomic data is anticipated to unlock new frontiers in personalized medicine. As AI systems become more adept at interpreting genetic information, they will help tailor treatments to individual patients based on their unique genetic makeup. This could lead to more effective therapies with fewer side effects, transforming how conditions are treated. 3. Telemedicine and AI support. The COVID-19 pandemic accelerated the adoption of telemedicine, and AI will play a vital role in enhancing remote healthcare. Predictive algorithms could improve patient monitoring and triage, making healthcare more accessible, especially in underserved areas. However, the reliance on AI in telemedicine may raise questions about data privacy and the accuracy of AI-driven assessments. Ethical and regulatory challenges. 4. Unpredictability and ethical dilemmas. As Sutskever warns, the unpredictability of AI systems raises ethical concerns. We may witness scenarios where AI-driven decisions result in unintended consequences, particularly in life or death situations. The healthcare sector, where AI is increasingly employed for decision-making, must prioritize ethical guidelines and accountability mechanisms to mitigate risks. 5. Need for robust regulatory frameworks. As AI technologies evolve, there is an urgent need for comprehensive regulatory frameworks to guide their development and deployment. Policymakers will need to collaborate with technologists and ethicists to establish standards that ensure AI systems are safe, fair, and aligned with human values. This could involve developing guidelines for transparency, data usage, and system accountability. Broader implications beyond medicine. 6. AI in other sectors. The implications of AI's unpredictability extend beyond medicine. In industries such as finance, transportation, and education, AI systems will influence decision-making processes. Anticipated innovations in autonomous vehicles and financial trading algorithms come with risks that must be addressed to prevent systemic failures. 7. Impact on employment. The rise of AI will inevitably transform the job market. While AI may lead to the creation of new jobs in tech and healthcare, it will also displace many existing positions. Societies must prepare for this shift by investing in reskilling and upskilling programs to help workers adapt to new roles in an AI-driven economy. 8. Societal disparities. As AI technologies become more prevalent, there is a risk of widening societal disparities. Access to advanced AI-driven healthcare solutions may be limited to affluent populations, exacerbating existing inequalities. Ensuring equitable access to AI advancements will be crucial in promoting social justice and inclusivity. Long-term vision. 9. Collaborative human-AI partnerships. The future may see a shift toward collaborative partnerships between humans and AI systems. By leveraging AI's analytical capabilities while retaining human oversight, we can harness the strengths of both to make more informed decisions in complex scenarios. This collaborative approach will be essential in mitigating the risks associated with AI's unpredictability. 10. Global cooperation on AI governance. As AI technologies transcend borders, global cooperation will be crucial in establishing standards and governance frameworks. International collaboration can help address the challenges posed by AI, ensuring that its benefits are shared globally while minimizing risks. Conclusion. Ilya Sutskever's warnings about the unpredictability of AI serve as a clarion call to embrace both the potential and the challenges of this transformative technology. As we look to the future, the promise of revolutionary medical advances and beyond is accompanied by a responsibility to navigate the ethical, regulatory, and societal implications of AI. By fostering robust frameworks promoting equitable access and ensuring collaboration between humans and AI, we can work towards a future where technology serves humanity's best interests while minimizing unforeseen risks. The journey ahead will require diligence, foresight, and a commitment to aligning AI development with fundamental human values.